Hi everyone. In this video, we are going to learn about thoracic duct. The topics which we cover in this video are: first we'll see introduction, next we'll learn about area of drainage, formation, course and termination of thoracic duct, relations of thoracic duct, tributaries and its clinical correlation. Thoracic duct. It is largest lymphatic vessel. It drains lymph from most of the body into the bloodstream. It carry lymph from most of the body and drain it into bloodstream. It has beaded appearance due to presence of numerous walls within its lumen. You can see the beaded appearance of the thoracic duct. This beaded appearance is due to presence of numerous walls within its lumen. Measurements. It measures about 45 centimeters in length, that is 18 inches in length, and 5 mm in width. 45 centimeters in length, 5 mm in width. Area of drainage. This is the area of drainage. If you observe here, thoracic duct drains lymph from all parts of the body except right side of head, right side of neck, right side of chest, right upper limb. And then remember three organs: heart, lung, liver. Right side of heart, right lung, right surface of liver. Now we are going to see formation, course and termination of thoracic duct. Thoracic duct begins as a continuation of upper end of cisterna chyli. Cisterna chyli is dilated lymphatic sac. It is present in front of L1 L2 vertebrae. Thoracic duct begins as a continuation of upper end of cisterna chyli. You can see the thoracic duct, it is beginning at the level of lower border of T12 vertebra. Near the lower border of T12 vertebra, thoracic duct is formed. It then enters the thorax by passing through aortic opening of the diaphragm. Thoracic duct enters the thorax by passing through aortic opening of the diaphragm. Aortic opening of the diaphragm is present at the level of T12 vertebra. It ascends through posterior mediastinum from the level of T12 vertebra to T5 vertebra. You can see the thoracic duct is passing upwards within the posterior mediastinum from T12 vertebra to T5 vertebra. At the level of T5 vertebra, thoracic duct crosses the midline from right to left side. You can see the thoracic duct. It is crossing the midline from right side to left side. It then ascends through superior mediastinum. It then ascends through superior mediastinum along the left edge of the esophagus till it reaches the root of the neck. In the neck, at the level of C7 vertebra, it arches laterally. Finally, it descends down in front of first part of subclavian artery. Finally, it descends down in front of first part of left subclavian artery, and it ends by opening into the angle between the junction of left subclavian vein and left internal jugular vein. Now we will see the relations of thoracic duct. We will study the relations of thoracic duct at four different levels: at aortic opening of the diaphragm, within the posterior mediastinum, within the superior mediastinum, in the neck. First, let's see the relations at the aortic opening of the diaphragm. At the level of aortic opening of the diaphragm, anteriorly, diaphragm is present. Posteriorly, T12 vertebra. To the right, azygos vein. You can see the azygos vein. At the level of aortic opening, to the right, azygos vein. To the left, descending thoracic aorta. Anteriorly diaphragm, posteriorly T12 vertebra, to the right azygos vein, to the left descending thoracic aorta. In the posterior mediastinum. In the posterior mediastinum. To the right azygos vein, to the left descending thoracic aorta. Anteriorly diaphragm, right pleural recess, esophagus. This is thoracic duct. Anteriorly we have esophagus. Anterior to thoracic duct, esophagus. Esophagus, diaphragm, right pleural recess. Posteriorly, see this is thoracic duct. Posteriorly we have right posterior intercostal artery, and behind that we have vertebral column. Right posterior intercostal artery, vertebral column, and you can also see terminal parts of axillary hemiazygos vein and terminal part of hemiazygos vein. Posterior mediastinum, to the right azygos vein, to the left descending thoracic aorta. Anteriorly diaphragm, esophagus, right pleural recess. Posteriorly, terminal part of axillary hemiazygos vein, terminal part of hemiazygos vein, right posterior intercostal artery, vertebral column. In the superior mediastinum. Anteriorly arch of aorta, left subclavian artery origin. Posteriorly vertebral column. Posteriorly vertebral column. Anteriorly arch of aorta and left subclavian artery origin. To the right, esophagus. To the left, pleura. In the neck, anteriorly, this is thoracic duct. Anteriorly, we have carotid sheath and its contents. Left common carotid artery, left internal jugular vein, left vagus nerve. Posteriorly, posterior to thoracic duct, vertebral artery, vertebral vein, sympathetic chain, prevertebral fascia, left phrenic nerve, vertebral artery, vertebral vein, medial border of scalenus anterior muscle, vertebral artery, vertebral vein, sympathetic trunk, left phrenic nerve, medial border of scalenus anterior, prevertebral fascia, thyrocervical trunk and its branches. Tributaries of thoracic duct. In the abdomen, upward continuation of the cisterna chyli. In the thorax, you can see a pair of descending lymph trunks and a pair of ascending lumbar lymph trunks. A pair of ascending lumbar lymph trunks opening into the thoracic duct. In the thorax, a pair of descending lymph trunks, a pair of ascending lumbar lymph trunks, lymph vessels from posterior mediastinal lymph nodes. A pair of descending lymph trunks from posterior intercostal lymph nodes of lower 6 intercostal space. A pair of ascending lumbar lymph trunks drains upper lumbar lymph nodes. In the neck, left jugular lymph trunk, left subclavian lymph trunk, left bronchomediastinal lymph trunk. Left jugular lymph trunk drains left half of head and neck. Left subclavian lymph trunk drains left upper limb. In the abdomen, upward continuation of cisterna chyli, a pair of descending lymph trunks, a pair of ascending lumbar lymph trunks, lymph vessels from posterior mediastinal lymph nodes. In the neck, left jugular lymph trunk draining left side of head and neck, left subclavian lymph trunk draining left upper limb, and left bronchomediastinal lymph trunk. Clinical correlation of thoracic duct. Chylothorax. If thoracic duct is injured during lung surgeries, it leads to accumulation of lymph within the pleural cavities called chylothorax, chylous fistula. If cervical part of thoracic duct is damaged during block dissection of neck, if it is not ligated immediately, it leads to the formation of chylous fistula, leading to leakage of lymph. Obstruction of thoracic duct. Thoracic duct may be obstructed by filarial infection, leading to chyluria, chylothorax, chyloperitoneum, chylocele. Let us now revise thoracic duct. Thoracic duct begins as upward continuation of cisterna chyli. It ascends within the posterior mediastinum and superior mediastinum and reaches the root of the neck. In the neck, at the level of C7 vertebra, it arches laterally, descends in front of first part of left subclavian artery, and ends by opening into junction between left subclavian vein and left internal jugular vein. Relations of thoracic duct. At the level of aortic opening of the diaphragm, anteriorly diaphragm, posteriorly T12 vertebra, to the right azygos vein, to the left aorta. Within the posterior mediastinum, to the right azygos vein, to the left descending thoracic aorta, anteriorly diaphragm, right pleural recess, esophagus. Posteriorly, right posterior intercostal artery, vertebral column, terminal parts of axillary hemiazygos vein and hemiazygos vein. Within the superior mediastinum, to the right esophagus, to the left pleura, anteriorly arch of aorta and left subclavian artery origin, posteriorly vertebral column. In the neck, anteriorly carotid sheath and its contents, posteriorly vertebral artery, vertebral vein, sympathetic trunk, prevertebral fascia, left phrenic nerve, medial border of scalenus anterior, thyrocervical trunk and its branches. Tributaries of thoracic duct. In the abdomen, upward continuation of the cisterna chyli. In the thorax, a pair of descending lymph trunks, a pair of ascending lumbar lymph trunks, lymph vessels from posterior mediastinal lymph nodes. In the neck, left jugular lymph trunk, left subclavian lymph trunk, left bronchomediastinal lymph trunk. Clinical correlation: chylothorax, chylous fistula, obstruction of thoracic duct.